Bismillahirrahmanirrahim. Assalamu alaikum. Welcome into my YouTube channel, Medicine Made Easy. Around 2 weeks ago, DRAID, that is the Drug Regulating Authority of Pakistan, gave permission to a couple of pharma companies to start marketing Resmetirom, a therapy for fatty liver disease. And just after that, I shared with you people 4 vlogs explaining different aspects of this Resmetirom. Many of my colleagues, they wished that I should share a short version of Resmetirom used in clinical practice. And I had promised that I will do so. Then I went to attend a medical conference in Turkey. And when I came back, my younger sister, she became critically ill and was admitted in hospital in ICU. And unfortunately, she passed away on Saturday last. So initially, I was involved in her being hospital, and then in the duas after the said demise of her. But I remembered my promise that I will make a short vlog on the clinical use of Resmetirom in clinical practice. And today I'm sharing that small vlog on clinical use of Resmetirom. So in today's vlog, we shall discuss briefly the important points of using Resmetirom in clinical practice. Bismillahirrahmanirrahim. Today we shall briefly discuss the use of Resmetirom in clinical practice. This is the basic concept slide. We know a healthy liver has a reddish brown color and little fat stored, less than 5% of the weight of the liver, that is the dried weight of the liver. It is because of the fat. When the fat starts to accumulate in the liver, this is called MAFLD, or metabolic dysfunction associated fatty liver. And when the fat accumulation causes inflammation and liver cell injury, this stage is called MASH. That is the metabolic dysfunction associated steatohepatitis. Means hepatitis because of the steatosis, and which is because of the metabolic dysfunction. And then the end of the story is that the liver cells transform into cancer cells and cirrhosis and HCC appears. Again, we should remember how the transformation of a normal liver is into the cirrhosis. The first stage is when the liver is normal and there is no fibrosis, and that is called F0. When the fibrosis starts appearing, the initial fibrosis, this is called F1. Then the second stage of the fibrosis is intermediate fibrosis, this is called F2. Then the advanced fibrosis is called F3. And when there's extreme fibrosis, this is called cirrhosis. And in the extreme fibrosis, the regenerative nodules in the liver appears. So the cirrhosis is the F4 fibrosis plus regenerative nodules. So the fibrosis stages, we divide them into F0, F1, F2, F3, and F4. Remember these two stages, F2 and F3, that is the intermediate fibrosis and the advanced fibrosis. We call this significant fibrosis. These two stages are important when we consider resmetirom to use in our patients. So the resmetirom is indicated in F2 and F3 fibrosis. There is no clinical benefits or significant clinical benefits when you use them in F0 and F1. And the data of using resmetirom in F4 fibrosis or cirrhosis is still awaited. So the clinical use is advocated in these two stages when a patient has got F2 fibrosis or F3 fibrosis. So the first step of considering resmetirom to use in our patient is that identify patients who are at the risk of the MASH. And who are those patients? Those who are obese, those who have got type 2 diabetes, those who have got fatty liver on ultrasound, they have done ultrasound and ultrasound shows fatty liver, are those who have got the first degree relative with MASH related liver cirrhosis. So these are the four groups of patients you should identify if you want to start resmetirom in your patients. So when you come across a patient who is obese or having diabetes or fatty liver ultrasound or this history or any combination, the patient may be having all these four risk factors or maybe having two risk factors or one risk factor. It is not required that at least two or three risk factors should be there. Any one risk factor present in a patient makes him or her potentially a candidate for resmetirom. So after identifying the patients at risk, you check the FIB-4. The FIB-4, it's a smartphone-based calculator. And when you put the data into it, then the results may be from range from any range. If the results are the FIB-4 results is less than 1.3, it is in the green group. When it is 1.3 to 2.67, that is double of it, this is in the yellow group. And if it is more than 2.67, then this patient is in the red group. What does it signify? If your patient is in the green group, that is the FIB-4 score, the patient was belonging to one of these four risk factors and FIB-4 results was less than 1.3, resmetirom is not indicated in these patients, and this patient should be put on surveillance or on the long-term monitoring. If the FIB-4 result was more than 2.67, then this is the patient who is in the need of resmetirom, and resmetirom is indicated. Remember, I said the patient should not be clinically cirrhotic. So this is simple. The two, less than 1.3, green group, and resmetirom not indicated, follow-up is indicated. More than 2.67, FIB-4, resmetirom is indicated. What about the yellow group? That is the FIB-4 between 1.3 to 2.67. In this case, you check FibroScan. And if the FibroScan results is less than 8 kilopascal, again, you put that patient into the green group where resmetirom is not indicated, but such patient needs follow-ups. But if it is more than 8, so this is the group where resmetirom is indicated. So you take the short of this algorithm and you treat your patients accordingly with resmetirom, whether the initial FIB-4 score was more than 2.67 or it was in the yellow range, but when you check the FibroScan, it was more than 8 kilopascal. Okay, what is the dosage form in strengths of resmetirom? It is available in tablets form in the 60 milligram, 80 milligram, and 100 milligram, and the dosage is based on actual body weight. For those who weigh less than 80 kg, it should be 80 milligram orally once a day. And those who weigh more than 100 kg, 100 kg or more than that, then 100 milligram OD dose is required for those patients. What about the administration? You can give it with or without food. And the storage is at 20 to 25 degree is ideal, but up to 15 to 30 degree for some time is also permitted. Don't use resmetirom in liver cirrhotic patients, in patients who are clinically cirrhotics. In pregnancy, data is not available. In lactating mothers and in pediatric age group. In these populations, data is not available yet. Drug interactions, as I said, these patients, they are diabetic, they are obese, so they may be using other drugs, and this is very important. If a patient is using clopidogrel, then you reduce, if the patient is weighing less than 100 kg, you reduce the resmetirom dose from 80 milligram to 60 milligram. And those people who weigh more than 100 kg, 100 and more than that, then they were conventionally we give them 100 milligram, but if a patient is using clopidogrel, then reduce the 100 milligram tablet to 80 milligram. Patients who are using gemfibrozil, resmetirom is not recommended in this group. Patients who are using atorvastatin, then limit the daily atorvastatin dosage to 40 milligram. Don't increase the dose from 40 milligram. Those who are using rosuvastatin, limit the daily rosuvastatin dosage to 20 milligram. Don't exceed this. And those patients who are using simvastatin, limit their daily simvastatin dosage to 20 milligram. Those who are using parvastatin, limit their daily parvastatin dosage to 40 milligram. Those who are using pioglitazone, you should monitor for pioglitazone related adverse reaction in this group when those patients are using resmetirom. And the patients who are on warfarin, there is no clinical significant interaction observed. So these are the commonly used drugs these patients who need resmetirom or whom you start on the resmetirom, they may be needed, and this is the dosage recommendations for these patients. Now, what about the adverse effects? We divide the adverse effects into those who are occurring in more than 10% of the patients treated with resmetirom, and those who are occurring in less than 10% of patients treated with resmetirom. In those who are the commonest one are who appear more than 10% of the patients on resmetirom. One is the diarrhea. This is the most common side effects, and it can happen into 23 to 33%. Around 1/3 of the patient treated with resmetirom may suffer from diarrhea, but later on this diarrhea subsides. Then the second commonest side effect is nausea, 15 to 18%. It means 1/5 of the patients, they may suffer from this. Then the ALT rise more than 3 upper limit normal in 11 to 13%, that is 1 out of 10. Then the AST more than 3 times, 9 to 12%. Then those adverse effects which are there, but they are less than 10%, and these are pruritus. In 6 to 10%, they may suffer from pruritus. 7 to 8%, the vomiting, and the constipation 5 to 8%. Abdominal pain, it is known side effects, but less than 10% of the patients, around 5 to 7% of the patients, they suffer from abdominal pain. Then dizziness, 4% of the patient, they may have dizziness. This is important. The AST may rise more than 5 times, but it is less than 5%, 1 to 4% may have AST rise more than 5%, and the more than 3 times is in 9 to 12%. Similarly, total bilirubin rise more than 2 times is in 1 to 3%. And ALT rise more than 5% is 2%. More than 3% is 11 to 13%, but more than 5% is rare. Around 2% of the patients being treated on resmetirom, they can have this. So, dear colleagues, we discussed today that in using resmetirom in the clinical practice, First of all, identify who are the patients who will need, who are the potential candidates of resmetirom. And these are if your patient is obese, if your patient has got type 2 diabetes, if your patient has reported to be having fatty liver on ultrasound, or if the patient has got family history of NASH-related liver cirrhosis. So if your patient falls in any of these four groups, he or she is the potential candidates for resmetirom. And then you check the FIB4, and depending upon the FIB4 results, either the patient is in the green group or if the patient is in the red group. In the green group, when the value is less than 1.3 of the FIB4, and in the red when the value is more than 2.67. In the red group, you start the patient on resmetirom, and in the green group, you just do the follow-up. If the FIB4 value lies between these two, then that means that 1.3 to 2.67, this is the yellow group, and here you need additional testing, and that is the fibroscan. And the fibroscan, depending upon the fibroscan results, if it is more than 8, patient is moved to the red group and started on resmetirom. And if the patient is having less than 8 kilopascal on the fibroscan score and initially was in the yellow group, then he's moved to the green group. And remember, the dosage is the tablet form, OD dose, with or without food, and depending upon the body weight. Those who weigh more than 100 kg, 100 milligram tablet should be given to them, and those who weigh then less than 80 kg, it should be 80 milligram dosage should be given to them. And do remember, I shared with you the drug-drug interaction, when to decrease the dose of the resmetirom from the 80 milligram to 60 and from 100 milligram to 80 if they are using clopidogrel. And then what the dosage recommendation is for the statins, I shared with you that, as well as zinfabrosel. I said don't use this drug with that, and with the those who are warfarin, there is no known interactions. So I believe that in this short vlog, the important clinical points must have been highlighted by me, and I hope that when you start this resmetirom using in your clinical practice, you will come up with your experience, and I will request that please share your experience of resmetirom with your patients in the comment section below, so this dialogue goes on and we start learning from one another's experience, and the benefit goes to our patients. So I end here. Thank you very much for being with me.